One, check. 1 2 check. 1 2. Iko sawa.
Check 1 2.
Mic 1 check.
One, two.
Hello, good evening. Mic check 1 2.
Hello.
Mic 1 check.
Kama yangu iko na echo mzima mwendo.
To one time.
Is located next to Simba Filling Station along Nakuru Mogotio Road, just 40 minutes from Nakuru and 5 minutes from Mogotio. Bamboo Woods Garden is a serene and versatile outdoor space, perfect for meetings, photo shoots, and team building activities. With its well-maintained gardens and peaceful ambience, it provides an ideal escape from the city's hustle. The venue also features a restaurant, serving delicious meals, ample parking for guests, and a relaxing environment for both corporate and social gatherings. The establishment also has a modern kids corner. Bamboo Woods Garden, a great getaway.
Naam, ujambo mpenzi mtazamaji popote ulipo, natumai ubuheri wa afya. Leo ikiwa ni tarehe 17 mwezi wa 5 mwaka wa 2025. Ndio ile siku Stella anarejea Kenya, lakini leo tunazungumza masuala ya non-communicable diseases with niko na Khalif Kandie ambaye ni clinical officer trainee ITech, niko na Josiah Tate vile vile registrar nurse na Kaunda Immaculate clinical officer pale ITech, ambapo we will be talking about the NCDs, non-communicable diseases. But before we move forward, I'll give everybody a chance, and I'll start with Khalif to give us an introduction. Karibu sana to our interview. This is Cosmo Media, na karibuni sana as we continue.
Okay, thank you so much. First of all, I would like to register my thanks to the Almighty for the wonderful opportunity that He has given us to converge here. It is not by design, but by His graces that we are converged here to talk about very important matters that affect our daily lives. And secondly, I want to also register my thanks to Cosmo Media and KE, because it is through those platforms that we are able to sensitize the masses, we're able to make them knowledgeable on matters which affect them on a day-to-day basis as regards to matters health. Therefore, I register my thank you, and as we go on,
My name is Khalif Musa, and I am a trained clinical nutritionist. Basically, what I do is I prevent diseases through the skills that I've learned over time in school, and I also manage these diseases from a nutritional standpoint. Besides that, I am engaged in research, basically trying to find out solutions from a nutritional standpoint to ensure that we mitigate the effects of these diseases in populations and in the masses. I also teach at ITEC, which is the African International Technical College, as a tutor where I teach nutritional sciences. And I have my team here. I would like to introduce them or pave way so that they introduce themselves. Thank you.
Good evening. Hello, viewers. Thank you, Cosmo Group. My name is Kanda Immaculate Gerono. I'm a clinical officer by profession. I'm a trainer at ITEC, that is African International Technical College, MOGOTIO. My role as a clinical officer includes clinical diagnosis and management and also health education. Thank you and you're welcome to this. Yes.
Okay. Good evening, viewers. Okay, my name is Ted Josiah. I'm a trainer at African International Technical College, ITEC. Also, I double up as the quality assurance at ITEC. I'm a qualified BSN, Bachelor of Science in Nursing. I'm a nursing instructor and clinical instructor at ITEC. Welcome on board.
Thank you so much, the team from ITEC, and that is how we commence our interview today, and we are talking about the non-communicable diseases. And I would like to take this opportunity, my fellow viewers from where you are watching, to welcome you officially and take us through, and we work together to this until the end of our interview. I will be glad so much as Cosmo Media to be part of this interview so that you can learn something, one or two, and you take a point home. And right about now, we're just going straight to the conversation, and I would like Khalif to give us the introduction or define what is non-communicable diseases.
Okay, thank you, Mr. Interviewer. So basically, when you talk about
Non-communicable diseases, we are talking about those kinds of diseases which we cannot pass from one person to another. And examples under this umbrella include diabetes, we have cardiovascular diseases, we have hypertension. So basically, we are talking about those diseases which you cannot transmit from one person to another. And the main causes of these diseases basically range from lifestyle factors, we have genetic factors, as well as how we exercise and all the sedentary lifestyles that we live, and the modifiable risk factors. So basically, that is a brief introduction to what non-communicable diseases are. Thank you. Okay, thank you. The reason as to why we have concern for these kind of diseases, and I would like to display for you an infograph that displays the mortality rates and the morbidity rates that basically show how we have a progression of these diseases over the years. Could you please confirm to me that you can see the mortality and the morbidity rates? So from there, for our viewers who are online, when you see the graph that is colored in blue, this is basically the morbidity rates, basically the number of individuals who fall sick from these non-communicable diseases. And also we have the red line there showing the mortality rates, the number of individuals who die from these kind of diseases. And as you can interrogate this graph, we are seeing that this graph is rising as we go on over the years. So it is of much concern that these diseases are on the rise year in, year out, despite the fact that we have adequate medical practitioners, we have advancements in medicine. So the question begs, why do we have this consistent rise in non-communicable diseases?
I first apologize, I said Kanda because of the way it was written, but Kanda Immaculate. On why focus on Khalif has touched on diabetes, and I would like you to expound for us why focus on diabetes.
Thank you, Mr. Kelly. So as Mr. Khalif has mentioned, diabetes is one of the non-communicable diseases. Why focus on diabetes? Non-communicable diseases prevalence rate is increasing at a very high rate, and also that means diabetes prevalence rate is increasing at a very high rate. The current statistics of diabetes shows that 6% of deaths in a year, that is in Kenya, is caused by diabetes. And what can we do as the community to curb this so that we cannot have the 6% rate? So the reason why we focus on diabetes mostly is because of the prevalence rate. Another reason is that 65% of individuals who have diabetes are undiagnosed. So somebody lives with diabetes, but he or she doesn't know. The reason why is because there is no any form of awareness. People doesn't know the risk factors of diabetes. They don't know what predisposes them to having diabetes. And if one lives without diabetes, if one lives with diabetes that is undiagnosed, it progresses to complications. And these complications, it will have an impact, both financial, economical, all sorts. It will have an impact on the individual, it will have an impact on the family, it will have an impact in the nation, it will have an impact on the society. So why focus on diabetes? We are focusing on diabetes so that we can increase awareness. We can increase on ways of preventing diabetes so that the prevalence rate can reduce, so that the death rates due to diabetes can reduce. Thank you.
And give us the categories. I'll hand over to Josiah to give us the categories of diabetes and explain for us further.
Welcome everyone on board. We've talked about diabetes,
the prevalence, but we have not defined diabetes. Well, diabetes is a very chronic condition that is characterized by insulin production or insufficiency. Insulin is a very important hormone in your body, which is secreted by the pancreas. The pancreas is an organ in your abdomen, which secrete insulin. So the insulin, when you talk about diabetes, your system can produce insulin but cannot synthesize it. So when you talk about insulin production, you can produce insulin but you cannot synthesize. So some of the risk factors to diabetes include age factors, but not limited to age factors. We have, she said, about weight, physical inactivity, and exercise. So welcome.
Thank you so much, Josiah. And I'll hand over to Khalif to add something on that.
Caliph, if you add something on that,
okay.
Thank
kindly.
you. So maybe just to add on whatever my colleague said, we have various types of diabetes.
We have type 1 diabetes, which is basically an autoimmune condition whereby
You realize that the pancreatic cells that are supposed to produce insulin are attacked by the immune system itself. So that is type 1 diabetes. Then we have type 2 diabetes, which is mostly as a result of insulin resistance, which grows over time as a result of bad diet. And as I said before, factors such as physical inactivity, and also we have gestational diabetes, which is prevalent among the women who are expectant. And we have other causes of diabetes. So anything that is going to impact on you have pancreatitis, which is actually the bacterial attack on the pancreas, we are going to also have a case of diabetes being presented in a patient or a person. Thank you.
Thank you so much, Caliph. And now we will move to our second question, or the third question, on the risk factors or the factors that affect the second diabetes. You have talked about the type 1 and type 2. You have explained the first type, and basically if you add on the second type of that kind of diabetes.
So basically, the reason as to why we are focusing on the
Second type of diabetes, well, basically the type 2 diabetes, it is because we have among this umbrella of diabetes the type 1 and the type 2 diabetes, as well as the gestational and the other causes of this disorder. You realize that type 2 diabetes has a very high prevalence, in the sense that we have 90 to 95% of cases of diabetes being reported, and we actually account this to the type 2 diabetes. So on to the risk factors. When you talk about risk factors, you're basically talking about those predisposing conditions which may lead to the development of these diseases. And under this, we have two types. We have the modifiable risk factors and we have the non-modifiable risk factors. Under the modifiable risk factors, we basically talk about those conditions which you are able to manage, those conditions which you're able to manipulate to ensure that you don't have the development of such conditions such as diabetes. And among them include the type of diet that a person takes. We also look at physical inactivity. What do you do day in, day out? Because you realize that most people these days don't exercise. Most people these days don't engage in physical activity. So these are some of the modifiable risk factors that you can change, and this is going to prevent or curtail the development of these diseases in a person. Then we have the non-modifiable risk factors. These are those factors which we cannot modify. For example, age. You realize that as you progress in life, your metabolic function is going to decline over time, and this can predispose you to developing such type of diabetes. Another thing is genetic factors. Okay, you cannot basically change the genetic makeup of a person. And also you look at the family history, because from the studies that we have and from research, you realize that if you have a family history of diabetes, along the line, chances are the offsprings that come in that line, chances are they may develop diabetes over time. So basically those are the two types of the risk factors. We have the modifiable and the non-modifiable risk factors, as I have explained.
Introduction or explanation further for that. Having now talked about the kinds of diabetes around, Kanda, I'm handing over to you to give us the signs and symptoms of diabetes.
Okay, thank you. Just to add on one risk factor, we have what you call another non-modifiable risk factor. We have the race. The blacks are more predisposed to getting diabetes as compared to the Caucasians. So it is a call to us, the blacks, to check on our lifestyle. So on to the clinical symptoms or the signs and symptoms of diabetes. We have the three classical signs of diabetes. Those are the three P's. 1, we have polydipsia. 2, we have polyphagia. And 3, we have polyuria. So polyuria is urinating a lot of times as compared to the normal times of urination. Polydipsia is excessive thirst. So through urination, you also feel a lot of thirst, so you get water many times. And polyphagia is eating a lot, excessive hunger. So after every time you feel hunger, you feel so angry. Apart from that one, we have other symptoms such as vomiting, which happens mostly in one of the complications of type 1 diabetes called diabetes ketoacidosis. Apart from vomiting, we have abdominal pains. Another one, we have sudden weight loss. Apart from sudden weight loss, we also have loss of consciousness. So those are the most common signs and symptoms. And one thing that you'd really put into consideration is that type 2 diabetes has a very slow onset. So these symptoms can be noted at a very late stage. So that's why we really encourage people to go for screening at least once a year. Thank you.
And Kanda, I've been taught about the signs and symptoms. Josiah, what are the most kind or the most common symptoms of diabetes?
Well, the most common ones in our prevalence rate now, as per the Kenya regulations, we have excessive thirst, that is polydipsia. We have excessive hunger, people eat a lot, and we have polyuria, people urinate. But in urination, it's very important for us to know the normal ones, the normal range. What is the quantity of urine you should excrete per day within 24 hours? So such kind of symptoms are very common. Yeah, those ones.
Ya kulegeza ulimi, umesikia kama unakula sana, unafaa ujichunguze. And kama una what else? Hiyo ingine ya katikati. Ya katikati. Hiyo ya kuhisi kiu sana. So for those of us wenye tunakunywanga more than 3 liters a day, we need to go check up. And Kanda has something to add. Maybe you can add something before we move to the second question.
So in addition to the signs and symptoms, diabetes can also present in its complications form. So one of the signs and symptoms is frequent exposure to infection. So glucose is a good media of bacteria transmission. So someone will always have recurrent infection. It could either be pneumonia, it could either be urinary tract infection, it could either be candida. Apart from that one, we have wounds that takes a lot of time to heal. It becomes like a very, very chronic wound that takes time to heal. Apart from that one, we have blood vision, or somebody loses his or her vision. Excessive glucose in their blood will have an effect in the visual. It also it goes up to the eye. What happens next is what is called retinal hemorrhages. We have what we call exudates. So these exudates in the eye is what causes vision loss. So onto the complications, one of it we have the diabetic retinopathy. So a lot of sugars in the blood goes to the eye. In the eye, retinal hemorrhages occurs. Another thing is we have exudates. So it is that one, retinal hemorrhages and exudates causes vision loss. Another one is what we call diabetic nephropathy. So this happens in the kidneys. So excessive glucose in the blood causes the blood vessels to be very stiff. So being usually the blood vessels are very elastic. So excessive glucose causes the blood vessels to be very, very stiff. So in this way, there will be poor blood flow to the nephrons. Nephrons are found in the kidneys. That is where nephrons usually do filtration of blood. So when the the blood vessels becomes very stiff, means the blood supply to the nephrons is very poor, and so kidney damage occurs. Another one, we have what you call diabetic foot. The same applies to blood flow. This one, which leads to poor wound healing because of poor blood flow. Apart from that one, we have coronary heart disease. The stiffening of the blood vessels causes what is called atherosclerosis. This atherosclerosis will lead to coronary artery disease or hypertension. When the blood vessels becomes very stiff, meaning blood will be pushed at a very, very high pressure, leading to hypertension. Then we also have another factors such as, apart from that one, we have what we call erectile dysfunction, which is mostly common in men. So in summary, those are the complications of diabetes. Thank you.
Somebody is asking, mumetumia kizungu mingi. Kizungu inakuwa mingi. So kindly, I think we will be elaborating using basic or the layman language also. And I'll hand over to you, Khalif, so that you can experience. There is something that Kanda has touched on issues about kidney failure. I think I want to understand, does diabetes lead to kidney failures?
So basically, to canvas on whatever Kanda has said, yani kuelezea zaidi kwa yale ambayo Kanda amesema, unapata that this diabetes, something that she has highlighted na ni muhimu sana, and we commonly see it kwa society. You realize that you can find a person suffering from diabetes, na bado kando yake unapata kuna hypertension, ama kwa lugha ya mtaani ama nyumbani tunaita pressure. So you realize that this diabetes becomes a risk factor for us developing other kind of diseases. And as she had said, we have cardiovascular diseases, we have kidney issues as well, and also as she said, we also have hypertension. So when I realize that these diseases, or the non-communicable diseases, they interact synergistically, in the sense that develop moja inaweza lead towards you developing another kind of disease. Na ndio maana sometimes, mostly from my clinical experience, waga napata labda mama ama mzee ama hata kijana mdogo amekuja na diabetes, then baada ya muda hii diabetes ina develop into hypertension and also cardiovascular diseases ama yale magonjwa ya moyo. So basically that was I was conversing on whatever that Kanda has said on that point. Okay.
Josiah, to give us how proper can we manage diabetes? Is there any preventable measures you as people expert in that field could tell us more, so that we can sensitize people and move this awareness to the people who are on the villages? People who are watching can take something home that kumbe ile kitu nomekuwa nikifanya, it might lead to that thing. We can start from you, Josiah.
Welcome on board. Before I proceed from your question, yes. I would also like to add the definition, like tumetumia kizungu mingi sana. We're talking about blood supply. the role of the blood carries oxygen. No, I hope madam akusema sana. So when kama kuna diminish, there is no poor supply of oxygen and stuff. So now some of the management kuna based on the risk factors. Having known the risk factors, we start from modifiable ones. What is your diet? Can you do exercise, such kind of activities? Diet, exercise, before being clinically diagnosed. You can do diet management, exercise, activity, clinical checkups, very important, and age. Okay, there are terms like non-modifiable, which are family ones, but come on, history a family with diabetes, it's very good to be diagnosed at a clinical stage. Maybe now, summary, early diagnosis, exercise, age, physical activity, and diet management. Very important. Caliph will focus on that, on diet.
So, thank you, Khalid. I think thank you, Josiah.
Sorry. I think, Caliph, you expound on that sector. You tell us more
About
on
the
what,
diet.
on the diving on what Josiah said.
Okay, so thank you. I have projected an infograph again on the screen. I want to see whether the controller has been able to project it. So, whatever that you have here is a graph that basically shows the insulin spikes. And we said that these insulin spikes are the reason as to why people end up developing type 2 diabetes. Basically, we are looking at the effect that food has on insulin. So from this graph, as you can see here, we have very sharp rises in insulin and very sharp falls on the graph. So what happens, just to explain whatever that is in the graph, when we take processed foods, and I know most of us here, we take those processed foods, ranging from asubui, for example, I know, and I can ask from the audience here, I know, and I'm very sure, you either took tea na mkate asubuhi ama chapati ama mandazi. So basically, that is the kind of processed foods that we eat. And once you eat this kind of food, you realize that you have a sharp rise in insulin because the sugar in these foods. And I want to clarify something very important before I go on discussing this. Watu wengi waga wanakuwa na misconception that when you mention sugar, unaongelea ile sukari ya meza. But clinically, going down, when you talk about sugars, you are talking about all the carbohydrates that you take. So ranging from the mkate that you eat, the chapati that you eat, the legumes that you take and everything. When the body now metabolizes these carbohydrates, the end product of this metabolism is what we refer to as sugars. So as you can see on the graph here, we have a very sharp rise. And this sharp rise is basically caused by the processed foods, the mkate, the chapati, and whatnot, which I've said. And then we have a very sharp decline. So maybe hiyo ni breakfast mtu amekula, insulin ikakuwa produced na ikashoot juu kabisa. Then after some time, because the body is now trying to control this sugar, most of the sugar will now be incorporated into the muscle cells, into the fat cells for use in the production of energy and storage. That is why you have a fall in that graph. Then kidogo kidogo normally, kawaida tena saa 4, mtu amekuchukua a cup of tea na mandazi, amekula tena. You realize we also have another sharp rise because we are taking processed foods. Unaona? Then kidogo tena baada ya muda imefanya nini? Ime drop. Then inafika lunch. Most of the time watu wanakula ugali, watu wanakula rice na beans. We also experience another sharp rise in this graph. Then baada ya muda tena, as you can see, it falls again because the body is responding to the sugars that we have. So what happens over time? If your body gets accustomed to these kinds of food, the highly processed foods, the rice that we take, the ugali that we take, and also the bread that we take, this is the pattern of insulin production that you're going to have. And over time, the body will be overwhelmed. And that is why you realize that the insulin will be produced. But because your body has been accustomed to these processed foods, what happens is your cells and the muscle cells and the fat cells, which are supposed to incorporate these sugars into the cell for action, you realize that we have insensitivity. You have insulin insensitivity. So as much as you're producing insulin, it is not sensitive to the sugars that is in blood. And that is why you develop the issue that we've said about you are not able to control the sugars in blood. So basically, this is an indication, and it is a red flag on how we eat. So one of the things that I advocate most of the time, and I'm going to show the infograph of a normal, because I have shown you the infograph for an abnormal one. I want to show you now the infograph for a normal insulin secretion. And I hope that that can be displayed here. So basically, as you see there, we have a steady rise of insulin as the body is secreting it in response to the sugar in blood. So this is the normal graph that you're supposed to have. We have a normal rise or a steady rise. Then we have also a very steady fall of the secretion in blood. So basically, this is what we are supposed to have on a normal occasion. And what drives this? It is basically the unprocessed foods that we take. Zile chakula ambazo tunatoa kwa shamba, the yams, the cassava, ile ambayo tulikuwa tunakula kitambo na tumewacha siku hizi because of urbanization and change in dietary patterns. That is where we are supposed to go to. Thank you.
Thank you so much, Khalid. And I want to take this
Opportunity to also thank, as we continue with our conversation here at Bamboo Gardens, the sole sponsor of this conversation today, and to just, if you have a question to ask, kindly forward it to our website or wherever you're watching us, and we will let the team here from iTech to give you an answer. Kama uko na swali, kama uko na a concern kwa the topic we are talking today, if you have somebody mwenye amekuwa affected and there is a way, in one way or the other, you may need assistance, kindly reach us as we continue with the conversation. Now, Kanda, there is preventions of diabetes. What are some of the preventions of diabetes?
Thank you. So prevention of type 2 diabetes mostly is about lifestyle. To mention the risk factors of diabetes, one of it being obesity. Another one is sedentary lifestyle. Another one is eating a lot of processed foods. So one of the things should be, one, physical exercise. The Kenya guidelines of diabetes recommend for any person who is diabetic to do exercise a minimum of 150 minutes in a week. So unaweza divide into like 3, it should not be consecutive days. Maybe you find exercise on a Monday for 50 minutes. Then on a Wednesday, ufanye for another 50 minutes. On a Friday, ufanye for another 50 minutes. So with that one, utakuwa una contribute to weight loss. Another one is diet. Anyone who is diabetic are very encouraged to really eat controlled, focus on controlled carbohydrates and fats. So mainly you will eat vitamins, that is fruits and vegetables, and sometimes proteins. Another way of prevention is regular screening. At least once in a year, as I've mentioned earlier, 65% of people who are diabetic are undiagnosed. So mtu anaishi na diabetes but he or she doesn't know. One of the reason being hakuna mtu anaenda for screening. So it is advised for people to go for screening at least once a year. Another one is sedentary lifestyle, which is eating a lot of processed foods. So that one is really, really discouraged. Focus on the naturally acquired foods. Apart from that one is those with chronic diseases or those people who are very vulnerable to getting diabetes, which includes the hypertension.
Bamboo Woods.
Another one is coronary heart disease. When they go for checkups, which usually happens after every 3 months, they are really encouraged to undergo all other forms of screening. For example, tumesema diabetes and hypertension are synergistic, kumaanisha like diabetes inaweza cause hypertension and hypertension can cause diabetes. So it is really good every time unaenda for clinic, you get screened for blood sugars. Thank you.
Something to add on that?
Yes, something to add on and just give an overall umbrella of whatever that she has said.
Yes.
What is important in their change, as she has said? What is also important
in the physical activities that she has said? It is
behavioral change, because you realize that for you not to find yourself predisposed to these factors, you need to change your behaviors. Because personally, I consider that the way you eat is how you are taught by your parents. So mimi personally, I can say mimi nilifunzwa kukula mkate na mzazi wangu from a young age, and you realize that
Bamboo Woods Garden is
No, Dako diabetic. You can be narrow, but yeah, talking. Yeah, you should very important. Audience know your BMI. BMI calculated by your height, your weight in kilograms over your height in meters square. The normal ranges, the normal WHO ranges is 18.5 to 24.91. Yeah, so you should calculate your weight. Maybe Khalifa can expound.
Basically, whatever my colleague here is saying, yeah. So basically, what my colleague here is saying is about the body mass index. We want to look at your weight relative to your height, and we have various indexes. And then we have class 1, class 2 obesity, and class 3 obesity. So when you find yourself that you've gone to the hospital and maybe the healthcare attendant has measured your BMI na amepata iko above 25, you are at a very high risk of developing these non-communicable diseases with a special focus on today's diabetes. So basically that is what my colleague was trying to explain.
Doctor, you have a number of young age children being diagnosed with diabetes and hiyo kuwa na kilo mingi. Yes.
Yeah, so basically, whatever that you say,
yes, kinds of food that you give children from a young age, the Weetabix kind, the Cerelac.
Remember,
diagnosed with diabetes. So unaona ni ugonjwa ambayo siku hizi ina affect kila mtu because of the kind of diet that we take. So unapata mtoto anakuwa introduced to these highly processed foods from a young age. By the time anafika 18 years or 22 years, the body has given up because it can't cope with the sugars that are being ingested in the body. So basically we have to change the type of diet, and it starts from a behavioral standpoint. Let us go back to whatever that our parents were feeding us back then. Wakati mikate haikuwa, wakati pasta, wakati hizi processed rice hazikuwa. Only then can we realize that we have a reduction in the number of cases of diabetes. So to answer that, I think I have done. Thank you.
Yeah, so to add onto that, kuna kitu inaitwa epigenetics. So that one is the practice of the mother sana sana, of the diet yenye anakula sana sana will have an impact on the lifestyle ya mtoto. So we assume a mother is pregnant, anakula very very junk foods. All of it iko rich in fats na a lot of sugars. So with that one, it will have an effect kwa mtoto most of the time. So what happens, we assume mother atapata gestational diabetes. So what happens, gestational diabetes, itakuwa na effect both on the mother na kwa the mtoto after amezaliwa, and even akiwa kwa the womb. So gestational diabetes in a little macrosome ama big baby ako above 4 kgs and above. So one, it will have an implication. One of it ni cost. Mtoto, mama mwenye ako na mtoto who weighs 4 kg and above hawezi deliver through spontaneous vertex delivery. That is like kujifungua kawaida. She will have
Now, Khalif, we want to look at the impact of diabetes in our community. I think in one way or the other, we have family members who have been affected. And according to your data, maybe you have, how is the impact?
say maybe before Ajibu.
Yes.
We are talking about risk factors. We are not talking about the causes.
Yes.
A risk factor is something that increases the likelihood of acquiring condition. It's no causal effect relationship.
So there are risk factors. In diabetes, there is no cause. They are just risk factors, okay? I hope I can clarify on that.
Josiah, you can now continue with my question.
Thank you.
Yes.
The interviewer had asked the impact that diabetes has. So
We have to look at the impact of diabetes from a holistic standpoint. You realize that diabetes has an effect on the individual. And I forgot to mention whatever that is coming out recently from research is once a person is exposed to stressful conditions, so unakuwa na chronic stress, it also becomes a risk factor for you developing diabetes as well as other non-communicable diseases. So what happens when somebody develops diabetes, it is going to have a mental effect on that person. Mtu atakuwa na wasiwasi, sasa nimedevelop diabetes, nitafanya nini? Then anapata stress. That is on a person. What about the family? The family will also experience the same. And sadly enough, if this person is the breadwinner of the family, you realize that this is going to have an economic impact in that family, in the sense that we are going to have a loss of livelihood. Mtu maybe may develop diabetes and therefore they can't actually provide sufficiently for their family. So this diabetes also has a very great impact on the family. Then beyond that, as a country, when we have a diseased population, you realize that we have a reduction in the workforce. Therefore, this is going to directly impact our economic capacity, and we are going to have a slowed economic progression because we have a reduction in the workforce. Another thing on the impact, we have the impact on healthcare systems, whereby unapata, because we have a great number of patients being diagnosed with diabetes, unapata the ratio between the patients and the healthcare givers inakuwa very inaongezeka sana. So unapata diabetes has an impact on the person. Diabetes also has an impact on the social life, which is the family life. Diabetes also has economic impact both on the person, the family, as well as the country and the county as large. Yeah.
Thank you, Khalid.
Khalid has said on the issue of diabetes in our communities.
So apart from the financial, we have the social. Financial, we have the social, we have the economical. So on the social part, the way it will have an effect, kama mtu akona complications ya diabetes or something like that, you will find that wanafaa waende clinic every time, maybe after a month, kama amekuwa newly diagnosed, akiwa on monitoring, maybe attend after 3 months. So apart from that one, anaweza pata complications. Now with that complications, atalazwa most of the time, meaning kutakuwa reduction in interactions. Apart from that one, also the family and friends, utapata it might have the financial impact. Now that one, kama kuna a lot of finances in the family or so, itachangia kwa part of stress. Sasa, where will they get the finances? Thank you.
Thank you so much.
Kanda, for that brief addition of information on impacts of diabetes in our society. Josiah, there is something in this government. There is a gap between the community, the healthcare system, and the government in terms of management of diabetes or the creating awareness. What might be the reasons why there's these gaps?
Okay. Maybe before I proceed with your question, also I like to add something on social impact of diabetes. We should not stigmatize people with diabetes. It's normal. It happens. Yeah. And then now the impact now, maybe we create awareness, creation of awareness, such kind of platforms create awareness. We create impact to diabetes to our community. Not necessarily we are not targeting the diabetic patients. We're targeting the community to create the content, to create the awareness. So maybe the gap is the awareness, but yeah, we can do that.
From where you say there's gaps, you as a high-tech college, what are some of the measures you have taken to create the awareness to the community, or what are some of the initiatives? I think I'll direct that question to Khalif.
So as I take college, what we are doing, we are equipping our students with relevant medical knowledge. And we are also teaching them on how to approach this issue at a community level, so that when they graduate from school, when they go out into the community, they are able to deal with these diseases, they are able to create more awareness, so that many people are sensitized on the effects of diabetes. And in doing so, we are going to reduce the staggering numbers of cases that we have. So as a college, that is what we can do. We sensitize, we teach our students so that they can go out and sensitize people more, so that we have a reduction in the numbers that we have.
Thank you so much. Josiah kuna kitu inamwasha.
We do medical camps, we do medical checkups for diabetes, screening for cancers, blood pressures, and such kind of things. Yeah.
Thank you so much.
And now, before we move to the next question, I think I will give this question to Kanda to give us the myths and misconception about diabetes.
So one of the myth and misconception about diabetes is that one, diabetes is a disease that is unserious. Diabetes is a silent killer. Symptoms of diabetes present later in the stages. So diabetes is a very serious disease. It kills. Another misconception is that diabetes is only caused by eating sugary foods. So that is one of the risk factor. Apart from that one, we have a lot of factors that can really make someone to get diabetes. And that one being, apart from the diet that you are eating, we have obesity. Another one is family history. Another one is race. Another one is age. Maybe Mr. Khalif can add on the myths and misconceptions.
Okay. On the myths and misconception, which I find very prevalent in the community, people don't know that sugars are entirely carbohydrates. Watu wengi wanafikiria hii ugonjwa ya diabetes inakuwa caused by the table sugar that you take. Ile ambayo unaongeza kwa chai unakunywa ina taste. Yeah, hivyo ndo watu wengi wanajua. Yeah. But basically, diabetes is caused by the high intake of processed food. So hizi mikate ambazo tuko nazo, the chapatis that we take, all these are sugars at the end of the day. The body doesn't recognize chapati as chapati. The body recognizes chapati as sugars at the end of metabolism. So kitu ambacho nimeona misconception sana, watu wanafikiria kuna sukari mzuri na sukari mbaya. For example, utaambia mtu awache kutumia the table sugar kwa chai. Yeah, anachukua asali anaweka kwa chai. And you realize that the body is just going to recognize asali as sugars. Another thing that is very prevalent is the brown bread and the white bread, and then we have the brown chapati and the white chapati. All these foods have the same effect when it comes to raising insulin and the effects that it has on blood sugar. Ni the same yote, hai change. So wewe pale unasema sasa mimi daktari ameniambia nikule brown bread niachane na white, all of them are the same. And you see, this becomes a very important gap for those educators that we have. Wale watu ambao wanatufunza about our health pale kwa university, pale kwa colleges. It becomes very important that we acquaint ourselves with relevant knowledge, so that tusiadvise watu kuinje unamwambia sasa now because wewe uko na diabetes kula mkate ya brown. The effect is just the same.
Sema uweke sukari kwa chai ama uweke kwa glass, is it the same thing?
Yeah, it is basically the same thing. Uweke sukari wapi?
Na mnaekanga kwa chai, mnaeka kwa uji. You have heard it from the horse's mouth that it is not the way we think. And I think this is one of the best conversation we are having. I'm learning something because since my childhood mimi nilikuwa naambiwa usilambe sukari, unaeka kwa chai even na chai. It is coming even sahi unasikia unaambiwa usiweke chumvi, the raw salt, uache even na chakula. So that is what is out there that people are talking about. And Kanda, you want to add something?
Yes, nataka kuadd on another myth. So another myth, watu wanafikiri diabetes is only for the older people. Tumesema kuna type 1 diabetes, kuna type 2, and we have what we call neonatal diabetes. So neonatal diabetes, mtoto mwenye amezaliwa na ako between 1 to 28 years old, huyo anaitwa neonate. So those children wanaweza pata diabetes na itaitwa neonatal diabetes. Type 1 1 to 28 days old. Sorry. 0 to 28 days. That
Okay.
is a neonatal. So anaweza pata what is called neonatal diabetes. Another one, type 1, mostly ina affect watoto. So diabetes si ya watu wazee peke yao, ni both ages. That is why like age is a risk factor. Yeah, thank you.
Maybe you start with Josiah.
I focus on the BMI. I think it falls on the misconceptions. You can be huge, you can be thin, but you can be diabetic. So si lazima uko mkubwa ndio uwe diabetic. You can be
Tunajua ule msee mwenye ako na mwili, most likely chances are 90% ako diabetic. But now the thing that I've seen that is coming up and it is changing the narrative is because when we grew up, we never saw children of young age being diagnosed with diabetes. I think it's a direct callback to how we do our lifestyle. Basically, the coming of junk food a lot. Mtoto crisps, chips, Cerelac, ndio hiyo sasa yogurt, because it's becoming a factor in our family. Because unajua kuna saa hata wewe kama uko na mtoto in one week you might carry yogurt twice a week. So it's becoming an issue to us. And maybe Kanda, you have something to add on that before we move to the next question.
So I want to add a point on the type 1 diabetes and stigma. So type 1 diabetes siko kwa watoto sana sana. So you'll find that watoto wanaenda shule and they will need to use that drug. Type 1 diabetes inakuanga managed sana sana na insulin. Kumaanisha they will have to inject. So mtoto mwenye ako na diabetes na ako shule, ako very predisposed to stigma very very many times. So watoto wenzake wanaweza sema huyu anatumia dawa ya kulevya or something like that, maybe because they are very innocent. So in such cases, we really encourage the schools to involve class teacher ama the school principal, so that even one of the complications that can happen, mtoto anaweza enter into hypoglycemic state, anaweza faint ama akwe unconscious. So we do what we call capacity building. Mwalimu afunze about the diabetes, what to do mtoto akifaint juu sugar zake zimeenda chini, what to do mtoto akikuwa unconscious, and also to encourage our like the friends of the students who stigmatize the individual. Yeah, that's what I wanted to say.
Thank you so much, Kanda, on that brief additional information. Na it's becoming a worrying thing. I think the coming of Gen Z teachers in school should be put in that progress so that walan, unajua we have ladies wenye washiki kitu shule. So I think this is one of the call, so that ukiona mtoto, you never know ni wa mtu mwingine leo, kesho ni wako. You never know, because I think all this thing does not belong to one family, even though there are some, those one you have said it can be inherited, but I think there are most of the cases right now are not even inherited. I think it's because of the lifestyle nature we are exposed to. And moving to that swiftly, we want to know how about the innovations that are there. Khalif.
Yeah. So before we go to the innovation, allow me to track you back. Zamani watu walikuwa wanasema diabetes ni ugonjwa ya matajiri. That is another serious misconception that we have. But what is coming out, the data that we have from research is that this disease is affecting everyone, regardless of where they belong in the socio-economic strata. Na ningependa kuchallenge maybe the county government. Wakati tuko na soko hapa hivi, hebu tupime hawa wamama zetu ambao wanafanya kazi kwa soko. Let us get the real data, the raw data on the ground. Tuone how much this disease is affecting our mothers and those people who are low in the socio-economic strata, because squeeze in affect kila mtu across the board. So on to the policies that the government is doing in a bid to mitigate and curb the rise of these cases of diabetes is: number one, the government is developing the management guidelines of this disease, and this is basically dispensed to practitioners so that they know how to manage this disease and also how to bring down the numbers from that guideline. Another important thing that the government is doing, and I've seen, is the training of CHPs and community health workers. So I've witnessed them being trained so that they go sensitize the public. But we may have gaps in this, the brand of knowledge that they are given. Because you realize that the information that you're supposed to give these people should be based on recent research. Therefore, mtu anaweza kuwa na advice mtu na guidelines za kitambo. So they should be taught on the recent guidelines that we have and the recent findings out of research that we have. Thank you.
Having said that, maybe Kanda, you have something to add.
To add on innovation, most of the time ikiwa during rainy seasons, kuna certain message yenye inakujanga, do this and this to avoid like being a victim of floods or something like that. So the same can be applied into diabetes. Kukwena like a message reminder or an SMS reminder, people to check on their diet. Maybe asubuhi useme, do this and this and this, mainly to check on diet, to encourage them on exercise, encourage them on being screened regularly. Apart from that one, we have what you call a tracker. So like a mobile app or so, it track your blood sugar levels each and every day. Yeah, that is it.
And before we finalize our conversation today, changing the tide on non-communicable disease, there's somebody
Call Joel was asked a question that how do you manage diabetic food blisters? I don't know. I will direct that question to who? Kanda.
So, diabetic foot is a complication of diabetes, and mostly due to the blood supply. So what usually happens is we try to control the sugars, ikuwe stabilized kabisa. Kama it reaches a point, we have oral lowering glucose agents, that is to lower the blood sugar levels. It's either the kumeza, that is the oral, and we have the insulin, that is injectables. So every time a patient akikuja for monitoring, we tutaona kama we compare the previous sugar levels na za saizi, and then we identify where our target should be, that is in terms of blood sugar levels. So at times when blood sugar levels ikiwa very resistant to the drugs, iko very elevated, mtu anaweza kuwa pricked even by a stone ama hata like a stick. So with that one, na mtu ako diabetic, it really progresses into a bad wound, na it heals at a very, very slow rate. So what usually happens, we try to stabilize the sugars, ikuje to the target ama to the normal ranges, because that is the sole cause of the diabetic foot. And then after that one, we do wound care. So we clean the wound, we prevent infection, that is through cleaning. When we do cleaning, we wear gloves, and we also ensure that there is infection control and infection prevention. Thank you.
Thank you, Kanda, on that issue. There is something you have touched on.
Kwamba kuna ule mtu mwenye hata akijikata kwa maybe sazila nakata mboga ama maybe ako kwa shamba agongwe na jembe ama anything, hiyo kitu kaalama kadogo inakuwa kinonda kubwa sana, but when it comes to healing now ina heal very slow. So is there a connection that chances are this person might be diabetic na ajijui, because somebody atakuwa maybe ameumia and then it take long, because I've witnessed one recently. There is a guy, a close friend of mine, alifinywa na mlango na that wound ikaanza kugrow. After growing, so ndo sai inarudi pole pole, but now inafura, inamsumbua, na ilikuwa tu a small hinge. So Khalif, can that connect to being diabetic, or you have some symptoms of being a diabetic?
So what I would like to say to that effect,
yes,
it is very important that that friend of yours goes to the hospital for diagnosis, because we can't diagnose hapa hivi. So it is very important that your friend goes to the hospital so that they can confirm what is the cause. And just to add on whatever Kanda has said, wale wagonjwa ambao wanakonga na they have this type 2 diabetes and they're living with it, huwaga tunawa advise wasivae viatu ambayo inawafinya, because you realize unaweza vaa viatu ambayo inakufinya, kisha baada ya muda hicho kidonda kidogo ambacho kimetokana na viatu kukufinya ina grow over time na inakuwa that wound that does not heal. So basically hiyo ndo kitu ambacho nilikuwa nataka kuongezea on whatever Kanda said.
And ladies and gentlemen, we are almost finishing our interview, depending as you can hear from the background, mvua inatukaribia na inasema mambo yenyu ni kumaliza na tukiwa katika hali ya kusanya virako ya kuondoka before we move to the next and then talk to the final thing. And maybe I just want everybody from this side to give me one or two things to call for action before we close the interview. I will start with Josiah.
Health education, we do health education and health awareness. Medical camps in the community and community outreaches. Yeah.
So, the WHO 2020 really set a goal that by 2030 they should achieve a certain strategies. One of them is that 80% of people with diabetes are diagnosed. To mention before that 65% of individuals who are diabetic don't know that they are diabetic. So goal moja WHO is that by 2030 they are going to achieve that 80%. Apart from that one is that 80% of individuals with diabetes have controlled sugar levels, so that we manage the sugar levels that anybody with diabetes we keep in the normal ranges. Another one is 80% of individuals with diabetes should have like a very normal range of blood pressure. To mention earlier that there is a relationship between hypertension and diabetes, that if someone has hypertension at some point in life anaweza pata hypertension and vice versa. So it's really good for them that if someone has diabetes, the blood pressure should be normal. So that is a call to action in the government. There is a really big gap. That means like we really have a lot to do. And then another call to action is that everybody has a responsibility at individual level, at community level, at the government itself, and as healthcare workers. So everybody should take responsibility in preventing or to curb non-communicable diseases and also diabetes. Thank you.
Yes. So my call to action will basically focus on behavioral change. Let us change in our behaviors. The way we approach food, it is very important that we focus on that. Let us try to avoid the highly processed foods. So kama wewe ulikuwa mtu wa kula mikate asubuhi, and I know chapati is very common these days, and you realize that kitambo chapati ilikuwa ya Christmas peke yake na masherehe, lakini siku hizi katakata is everywhere. So you realize chakula kama hizi zikikuwa everywhere, yani tunakula chapati, tunakula mkate, you realize that we have a very high prevalence of the development of type 2 diabetes. Another call to action, and especially for the men, I usually challenge men to start exercising. Na ukifanya mazoezi haimaanishi ati lazima uende gym. Even walking some few kilometers is an exercise. And the recommendations that we have for those individuals who are maybe overweight and obese, you can't start doing intensive activity. What you start by walking. Then after you have shed some weight, you can start jogging. Na wakati weight yako imekuja vizuri sasa, now you can now engage in the intensive physical activity. And one thing that I would like to challenge all of us, and I do this personally, nafanya hivi. Wakati umetoka kwa bafu asubuhi, funga taweli yako ama baki na boxer yako. Stand in front of that mirror. Look at your stomach area. Jiulize, am I proud? Thank you.
Mambo inachamuka hapo kidogo. Khalif, amesema for men in this world there are only two things. Wanasemanga ni bidii ya mwanaume ni kitambi na mimba. So hizo ndo bidii za mwanaume. So having said that, we have come to the end of our conversation with the people. But before I close, Khalif, I want to give you an opportunity of 1 minute to talk about ITEC College. Yes.
So thank you, the interviewer. All of us here in this setting here today, communicating to you guys, na ni kwa sababu tumetoka ITEC wote sote. The common thing about us here is that tumetoka ITEC, and you see ITEC College has brought significant change in this society. We have students coming from Mombasa, tuko na wapi, and the changes that we have in the society is very it is tangible and you can see. And pale ITEC we have various courses ranging from healthcare and medical courses. Tuko na courses zingine za catering, tuko na secretarial. We have very many courses, and I would like to encourage everyone ambaye ametoka form 4 na maybe haja join college. It would be very good that you join us there, where you're going to get quality education. And as you can see here, the panelists are well skilled and well knowledgeable in their fields of expertise. Therefore, ukikuja pale, you are rest assured that you are going to get quality education. And the reason for you getting this education is to ensure that you impact change in the society at the end of the day. That is the only thing about mambo ya masomo. You learn from the best, as you can see here, and you impact the change now in your own community. Thank you.
Thank you so much.
Khalif, thank you so much. Kanda, and thank you so much, Josiah, for having time to converse with us. I think our viewers out there have gone home with some information that they didn't have. From us here and from all the crew, tuko na team kubwa sana hapa ambao wamefanikisha mazungumzo haya siku ya leo, na tuseme shukrani sana kwa Bamboo Gardens kutupea nafasi kila na wakati tukiwa na mjadala tunakuja hapa kuzungumza na wao. And we want to tell you guys, if you have a small meeting, if you have a birthday, if you have a conference, if you want to host wedding, kama unataka kufanya engagement yako, karibu sana Bamboo. It's just along Nakuru Mogotio Highway. It's just adjacent to Simba petrol station. Utaiona tu bana ya Bamboo hapo, then utakuwa unashughulikiwa hapa. It's a home away from home. Thank you so much. My name is Kelix. On behalf of the team, we want to sign out and say thank you until our next conversation. Remember, tutakuwa tunazungumza on health issues frequently. From us, thank you and good night.